Welcome to everybody who has taken time out of their day to join the launch of the updated Working Together Guide, which I am co-hosting with the CEO of CHF, Elizabeth Devenny. First of all, I would just like to say welcome. And I would also like to, before we get started, acknowledge the traditional owners on the land on which we're meeting today. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people today. I'm on the land of the Ngunnawal people and I pay my respects to the elders past and present of the Ngunnawal people and any families with connections to this land. I'm going to ask Elizabeth to give an acknowledgement of lived experience.
Thanks so much, Liz. I'm also on Ngunnawal and Ngambri country, so thank you for that lovely acknowledgement. For CHF, it's really important to acknowledge the experience of people who have lived various health situations. So I'll start by saying that we acknowledge and deeply respect the lived and living experiences of health consumers, carers, families and communities across Australia. We recognise the right of every person to equitable access to healthcare, regardless of their background or circumstance. We value the lived experience, expertise and personal commitment of consumer health advocates who work very hard to influence change. And we seek to elevate the voices of those who have navigated the complexities of the healthcare system and partner with them to drive meaningful and inclusive change. Thanks, Liz.
Thanks, Elizabeth, and that's such an important acknowledgement and really is sort of underpins the reason we're here today. So the purpose of today's webinar is to launch the updated Working Together Guide, which is a framework for collaboration between health consumers, health consumer organisations, and the pharmaceutical industry. We have 4 panelists today, and I'm going to introduce them all to you now, and then we'll start with our sessions. Elizabeth Devenny is the CEO of the Consumer Health Forum. Elizabeth is going to talk about meaningful engagement with health consumer organisations and why meaningful engagement matters and how collaborations can support stronger advocacy, health literacy and system-wide improvements. Next, we will hear from Melanie Funk, who is the Managing Director of Eczema Support Australia and member of the Project Advisory Committee that co-designed the Working Together Guide. Melanie will share her experience and insights into the co-designing of the guide and reflections from the advisory committee process and how co-design strengthened the guide and ensured health consumer perspectives were embedded. And Anne Single, who is the CEO of Patient Voice Initiative, was also a member of the Project Advisory Committee and will touch on the importance of building partnerships, experiences of working with a diverse range of pharmaceutical members, and share some examples of good practice and the importance of consistency, trust, and transparency. And lastly, we will hear from Lucy O'Brien, who is the Ethics and Compliance Officer at Medicines Australia, who will share some new resources that will support health consumer organisations and members to engage more effectively and changes to the Medicines Australia Code of Conduct, the new edition that relates to patient engagement. Firstly, I'd like to go a little bit through the history and evolution of the Working Together Guide. The Working Together Guide was first established with the Consumer Health Forum in 2005. It was updated in 2008, and a 3rd edition was introduced in 2015 with some important updates. Then there was a long break till 2025 when we had the global Working Together shutdown of COVID, followed by the new ways of working together post-COVID, where we saw a rapid evolution of working from home, digital utilization, Zoom meetings, which we're enjoying today. And we realized that it was timely and important for us to work closely with our partners in the Working Together Guide to update to this latest edition. This edition has been co-designed with CHF and the Project Advisory Committee, which consisted of members of health consumer organisations, as well as the pharmaceutical industry, And we will be hearing from a couple of the advisory group members today, as I already said. The shift was needed in terms of our evolution in the Working Together Guide, because patients and health consumers are no longer passive receivers of healthcare. They no longer react to things. They are proactive and require proactive, person-centered partnerships and need to be part of the decision-making about their healthcare. Recognition of patient input as critical evidence in the whole health system has been really evolving over time, and patients are the end users of the medicines that we develop as an industry, and therefore are the most important stakeholder that we should deal with. So this is a framework for meaningful collaboration to improve health outcomes and ensure that patients are at the center of health and can be involved more deeply in the medicine's development life cycle, earlier, more often, and more importantly, meaningfully. The benefits from an industry perspective of working with health consumer organizations are that consumer insights drive better medicines and treatments. As Elizabeth has already said, the importance of lived experience helps companies to actually design medicines that meet patients' needs rather than healthcare professional needs or health system needs. And therefore, these insights from consumers can help inform research priorities, trial design, and models of care that meet the diversity of the patient population. The unique perspectives on living with a condition that consumers can provide gives an understanding of the daily realities of a disease and also the impacts of certain treatments. And these inputs extend beyond symptom control to the broader impact on families, carers, and the burden of those illnesses on everyone that they are involved with. We also need to improve the design and delivery of healthcare, and that includes how health consumers use information, access support services, access treatment pathways to ensure that they are practical, accessible, affordable, and relevant. It's also important for us to work with consumers to develop better policy outcomes for our health system. Consumer voices strengthen advocacy around affordability, around access, around equity, and they help ensure that medicines and services reach those who need them most. Early and continuous consumer engagement leads to smarter clinical trial designs, more relevant outcomes, and more effective health technologies and health partnerships, and creates opportunities for innovative partnerships that deliver mutual value. Embedding consumer perspective throughout the medicine's life cycle will ultimately lead to better health outcomes, better adherence, and improved quality of life. But the health landscape has been shifting, and there is a much greater involvement of consumers and health consumer organizations in health system development. As we know, patients are no longer passive receivers of healthcare or reactive to health changes, but they are proactive seekers of better health outcomes. Government has a strong commitment to health consumer engagement, and we've seen formal seats placed on the advisory committees, recognition of the importance of consumer evidence, and hearing from consumers has become part of their daily policy development requirements. They recognize that patients and health consumer organizations and their representatives' role in developing healthcare policy and healthcare systems has evolved. Industry has a stronger commitment to hearing from consumers and to ensure that their engagement with consumers remains transparent and ethical and involves consumers in decision-making. The changing roles of patients in co-designing trial designs and co-designing that engagement with the industry has been a real evolution. But also the policy landscape has changed as well. And we recognize, more importantly, that patient inputs are evidence. Patient-reported outcomes and patient-reported experiences are evidence. And our system needs to evolve and our policies need to develop to ensure that that evidence achieves and receives the due process and the weighting that it requires when making decisions about patients. And there is a long used phrase, nothing about us without us, that we hear a lot of health consumer organizations use. And I think that's become the underpinning of why the industry needs to work closely with patients and why we need to maintain a very transparent, open, ethical, and reliable collaborative framework. Nothing without patients, nothing about patients without patients. So I'm really looking forward to today's conversation. I'm going to hand over to our first speaker today, Elizabeth Deveney, as the CEO of the Consumer Health Forum, who's going to give her perspective on why meaningful engagement with health consumer organisations is important and how we can support stronger advocacy, health literacy, and system-wide improvements. Thank you, Elizabeth.
Thank you so much, Liz. And good afternoon again, everyone. I'm really delighted to be here today for the launch of the latest edition of the Working Together Guide. At Consumers Health Forum of Australia, our role is simple to grasp, but actually quite complex to live. We're here to make sure that the voices of health consumers are central to decisions about healthcare. And the principle that guides us, that you mentioned, Liz, nothing about us without us, it's been around for about 500 years. We're still asking. This guide really matters because it gives us a way of shaping how health consumer organisations and industry work together. These relationships are essential for both parties. Yes, at times they can be challenging, but they often bring the opportunity for real innovation. And what's really critical is that as they develop with both trust and transparency. For many consumer organisations, partnerships with industry are not optional. With little or no government funding, organisations like these often rely on things like fundraising, grants, and sponsorship to survive. So partnering can keep the doors open, which is vital for the communities they serve. But this should always be done in a way that safeguards each organisation's independence. Consumers, of course, are not simply the recipients of care. They are experts in their own right, often for many years or even decades, getting to know a disease that might just be one lecture in a health professional's professional education, 1 hour perhaps. They have perspectives about affordability, access, side effects, and quality of life that randomised controlled trials alone cannot fully capture. If our shared goal is better medicines, better healthcare systems, better community outcomes, then consumer voices have to be in the room. Not as decorations or as tick boxes, but because of their genuine wisdom and expertise. We often say that consumers are not passengers in the healthcare system. They are indeed integral parts of the system and a driving force. If their perspective is missing, we risk steering in the wrong direction. And some of you would have seen that happen over your professional careers when the consumer voice hasn't been involved in a policy or the implementation of a piece of work. Of course, any partnership can bring risks as well as all the benefits that it has. There's no point pretending otherwise. Of course, there's the yin and the yang. There can be a real power imbalance between a large commercial company and a small not-for-profit organisation, perhaps a powerful executive or an individual who's unwell and perhaps also living with a disability, between an industry with resources and a community that relies on volunteers. And the question that lingers for many of us is this: can health consumer organisations stay truly independent while receiving funding from organisations whose commercial interests might also sway their views in ways that are not in the community's benefit? So this guide doesn't ease those risks or take them away, but it does give us really great principles to manage these risks: independence, transparency, accountability, and integrity. It's not a magic fix, but it is a shared foundation for us to work on together. The community, consumers, and indeed governments expect clarity about how decisions are made and how these very important relationships work. If the partnerships aren't transparent, trust weakens, and once it slips, it can take a long time to rebuild. So this guide offers a framework to make these expectations clearer on both sides. It doesn't eliminate the complexity that's part of our daily work, but it does give us great tools to navigate with more confidence. Now, I'll be the first to admit, I am not heading off to Officeworks after this to buy a framed for putting the guide in. But if we're really honest, the value isn't printing it, downloading it, saying we went to a webinar. It's in its use. That's what's going to make the difference. So our partnerships can't also be simply transactional, a check on one side and a logo on the other. They must be, and all the best ones indeed are, collaborative and even sometimes transformational for all of those involved. If consumers bring their courage and their lived experience to the table, the least the rest of us can do is bring transparency, respect and clarity. So my invitation is this: let us treat this guide really as a floor, not as the ceiling. For health consumer organisations, it's a tool to safeguard independence and strengthen our voice. For industry, it's a chance to engage with consumers as equals, to be transparent about aims and constraints, and to show partnerships that really do improve health outcomes and transform our healthcare system. The guide and all of us here are not pretending everything's simple. We're here to acknowledge the complexity and committing to doing better within that complexity. Because in the end, actually, consumers don't care about our partnerships or our guides or anything else. They care about the health outcomes. They want to know that what we do leads to better outcomes for them, their family, their friends, their children, their communities. That's what really matters. So if we can use this guide to build these partnerships that are transparent, independent, highly productive, consumer-centred, then we've done something really worth doing. So here's to putting that into practice. That's our hope. So, and I'm now going to pass on to our next speaker, Melanie. Thanks, Melanie.
Thank you so much, Elizabeth. I think, you know, what you said there about the need for collaboration with independents and partnerships for health outcomes, the way you expressed that really resonated with me. Before I begin, I just wanted to also acknowledge the traditional custodians of the land that I'm joining you from, the Coomera people who are part of the larger Yungan language group here on the Northern Gold Coast. And I pay my respects to elders past and present, and I extend that respect as well to all Aboriginal and Torres Strait Islander peoples joining us today. One of the real strengths of this project was how genuinely co-designed it was. The advisory committee brought together such a diverse mix of voices: consumer or patient support organisations, industry representatives, and independent facilitation as well. That diversity meant that we weren't just reviewing words on a page, we were testing ideas against real world practice. And we kept asking ourselves, does this reflect lived experience? And importantly, does it work for both smaller volunteer groups and larger, well-established organisations? And what really stood out to me was that the process itself lived out the very principles of the guide, the openness that we shared, the transparency and the respect, and the embedding of the consumer voice or the patient voice at every single step. It didn't feel tokenistic or theoretical to me. It felt collaborative and genuine. So I think because of that process, the final guide is both stronger and more useful in real world. It keeps the consumers, the carers, the patients right at the centre with a clear focus on improving health outcomes. And it strikes that balance, I think, between aspirational and practicality. It's not just about ideals or big statements. It's something that people can actually use with fact sheets, examples, and clear guidance on how the principles apply day to day. I think it also builds trust because when you've got independence, transparency, and integrity woven through it, that really does help. And maybe most importantly, because it was co-created, everyone involved can see themselves reflected in it. That shared sense of ownership means that it's far more likely to be used widely and consistently, not just admired, but hopefully applied. And I just wanted to add why this really matters, especially now. When you've got I think strong ethical partnerships are not just optional, they're essential if we want to improve health outcomes for Australia, just as Elizabeth was talking about earlier. We're all working in a time where misinformation and uncertainty are increasing, not only about health and medicines, but even about the value of evidence itself. And the global and economic pressures are really eroding public trust. And that has a very real impact on our work as patient support organisations and the people that we serve. Both patient support organisations and pharmaceutical companies, make it strong, transparent, evidence-based collaboration. That's more important than it ever has been. So by working together in line with the principles of this guide, we can provide clarity, build trust, and ensure that consumers and patients have access to reliable information and care that they can depend on. So I'd just like to say being part of this project advisory committee was really a privilege. It gave us a chance to contribute to something practical and hopefully lasting. Not that it won't need updating in the future, but it's now a pathway for strong, transparent partnerships between health consumer organisations and the pharmaceutical industry. And through this collaboration with Medicines Australia and Consumer Health Forum, we've created a guide that's, I think, grounded in real-world experience and shared values, and that ultimately benefits consumers, carers, and families. So on that note, I'm really delighted to hand over to Anne Single, CEO of Patient Voice Initiative, also a member of the Project Advisory Committee. And also just wanted to mention Anne is also a really strong international voice for us in this field, as evidenced by her sharing with us today from across the other side of the world. So thank you, everyone, and thank you, Anne.
Thank you, Melanie, and thanks Medicine Australia and Consumer Health Forum for this update to the guide. And I just wanted to mention also Jenny Parnham, whose work was just so impressive and knowledge was so impressive as we worked together on this guide. I also want to pay my respects to elders past, present and emerging. So just in the next few minutes, I'm going to share a little on good practice, some examples of working with a diverse range of pharmaceutical companies, and an opportunity for you to take part in benchmarking survey that's been designed to support our interactions between pharma and our health consumer or patient communities in ways that matter most to health consumer or patient communities. So if you know Patient Voice Initiative, you know that our mission is to ensure that patients are seen, heard and valued in decision making, especially health technology assessment. And that's that process for deciding what is funded on our PBS and our Medicare. And our focus is improving HTA for and with patients, but doing that requires us to really work effectively with all who do HTA or shape it or contribute evidence to it. And we think change happens by linking arms, excuse me, working together, moving together, and learning together for better outcomes. So in our role supporting patient communities and consumer organisations to navigate HTA and provide targeted input, we realised that there was great variation in practice, for example, in what information about applications is provided by industry to consumer health organisations, and also how patient knowledge is understood and valued. We also saw that there were varying expectations about the need for interaction. So that got us really interested in the work of the Working Together Guide. Meanwhile, in Patient Voice Initiative, we also rely on multi-pharma sponsorship to fund much of our work. And because we believe that the relationship begins with clarity about shared goals, we meet with our sponsors at a quarterly roundtable and we share updates. But critically for us as an organisation, we have the opportunity to hear what sponsors are seeing or what they're thinking about. And as a result, we observe that companies have different beliefs and behaviours about patient knowledge and different approaches to interacting with the community. And we think this matters if we're going to transform health and decisions about healthcare. So our long-term in-kind supporters at Capri had seen something similar from their work. So pro bono, they worked with us to research which domains matter to Australian patient or health consumer communities when interacting with pharma. And then they used these domains to create a benchmark survey to determine which are the most important and how satisfied community is with these current interactions. And you can find a 2-page summary of this research in the fact sheets. It's here, 1 page of it on the screen, fact sheet number 5 of the Working Together Guide. And it highlights the domains that matter and what areas pharma companies should consider when thinking about these interactions. And this research really strongly aligns with the guidance in the Working Together Guide because it highlights that funding or sponsorship is just one domain of importance. Actually, one of the really clear messages was that patients and their organisations wanted to be understood as knowledge holders, not just people with an interest, but people who have knowledge that is of value to the health system and to companies and anyone else working to improve patient outcomes, and actions that demonstrate this valuing of the knowledge, e.g. by acting on it or showing competence in patient knowledge, really build trust and a feeling of respected. In my work with the Interest Group for the Patient and Citizen Involvement in the International Society, HCAI, I've seen that this is a real predictor of project success. Our projects are all multi-stakeholder, multi-country, multi-company, and sometimes multi-funder if money is required. And we begin by sharing an agreed problem or goal. And an example would be a lack of information about applications submitted to HTA bodies, which prevent patient communities from making more informed or targeted input. So we saw that problem and then we started to think about whose knowledge is needed to solve this. So we end up with a multi-stakeholder approach. And then we think about how best can we work together to bring all this knowledge together to create a solution. So HTAI's international template for creating plain language summaries of applications and the follow-up projects associated with it all have co-leaders from patient organisations, industry and HTA bodies. And because everyone agreed on the problem, we all knew what we needed to learn from each other and create a solution. And I think this is really key. Before I hand over to Lucy, please note that we also have a follow-up survey going on the benchmark survey to see what patient communities think is important and how satisfied they are in their interactions with pharma in 2025. And so you can complete it as a patient, a health consumer, a carer, or a health consumer or patient organisation. We'll take up to 3 replies from all organisations, and you will receive a payment for the time. The survey closes shortly, so please follow that QR code to register, and a link will be sent to you. We'll also report back to you and all who participate. And do check out the Working Together Guide along with all the fact sheets that have been produced because they're incredibly useful. If you have any questions about this or actually anything else from the presentations before me, please pop them in the Q&A box. But now I'm pleased to hand over to Lucy O'Brien, who's going to discuss how the code relates to the guide.
Thank you so much, Anne. And thank you to everyone who's presented today. It's been a real pleasure to be a part of this. I'm from a bit of a different area in Medicines Australia. I'm from the Ethics and Compliance team. And I thought it would be a really good opportunity just to talk about, in the spirit of working together, some resources that we've been developing in the background. So for those of you who aren't aware, I work quite closely with Sophie Seck, who is the senior manager, and together we make up the ethics and compliance team. Our main role is to administer the code of conduct, which is pretty much the ethical standards that pharmaceutical companies have to abide by, when they're engaging with various stakeholders, including health consumer organizations, as well as how they're able to advertise their prescription medicines. So we had a consultation about a year ago now with some key representatives from health consumer organizations who gave us some insight into, I suppose, some of the questions and the common, I guess, issues that were coming up in terms of, what they wanted to know about our regulatory system and how the code of conduct can influence, how pharmaceutical companies interact with the patient community. So from that consultation, we distilled about 7 different topics that kind of covered the common questions that we were getting. And we really wanted to, I suppose, develop an educational resource that was to educate mainly towards the patient community, what the code of conduct does, how it operates, and why it is the way that it is in terms of its regulation. So we've put this together in the hopes that it, will help promote strong relationships between industry and between the patient community, with an understanding of how our regulatory system works. So up there, you can see a few of the different topics. I haven't put them all up, but a few common topics were event attendance, financial sponsorship, like you were mentioning, and that's a huge part of the engagement with pharmaceutical industry. And, what kind of information can pharmaceutical companies talk to you about? And more specifically, things like clinical trials and access programs. So I've put a QR code up there which should take you to the 7 different fact sheets, and I'd really encourage you to have a look and share amongst your colleagues, just for an understanding of what the code of conduct does. It's also part of, I guess, a multi-phase approach that we're taking. We're also going to be working on some videos which will hopefully come out in the next few months or so. Some short videos that are related to this content. And Sophie and I are also looking at, later down the track, hosting some biannual Q&A kind of drop-in sessions where, we'd be really happy to have, patient organizations or patient representatives to drop in and ask any questions related to, anything with the regulation or the code of conduct, or any concerns that have been cropping up, so that we can have an open dialogue. And I think this is part of our commitment to the Working Together Guide principles. Even though the code of conduct sits a bit separately, it is a testament to how this is a cohesive system and how consumers do sit at the center of that. I just did really want to quickly shout out as well that our members were a really key stakeholder in putting together these fact sheets. So we had a diverse pop-up group, from compliance colleagues to patient advocacy colleagues, comms. So we had a lot of different people who came together to put these fact sheets together for the patient community, with the hopes that it would give a really good resource for understanding our system. And so we couldn't have done it without our members as well. So I just wanted to shout them out. So that's it from me. I just wanted to really briefly, put that through. But now we're going to go to a Q&A session. So if you have any questions, thank you.
Thanks, Lucy, and thanks everyone for some really insightful commentary. We've got over 80 people on the line. I can see a couple of questions coming in, but I'm sure there are lots more burning questions. You can put your question either in the chat or in the Q&A box, but please to make your question. I firstly just wanted to remind everyone that we are recording this session. So if there are answers that you hear today that you want to go back to, you'll be able to go back to that. But I also wanted to point out 3 QR codes. There's a QR code for the Working Together guide. There's a QR code to join the latest benchmark survey for Capri. And there's a QR code for the fact sheets that Lucy has just announced. I really do encourage you to stop the recording, click on the QR code and go to those resources, because we will eternally receive feedback. So I know that the Capri benchmark survey will deliver more feedback than Anne is looking forward to, but it will feed the next survey and more questions, no doubt. But certainly from our code perspective, if there are things in the fact sheet that don't answer the question you've got, feedback to us so that we can improve our fact sheets. And similarly with the Working Together guide, if it doesn't answer the questions that you have, I know that both the Consumer Health Forum and Medicines Australia will be keen to understand what's missing and what are the things we can do to continuously improve our ability to work together. So someone's asked us in the question, and Patrina's noted to the chat to everyone, we will be also sharing the slides, so you'll be able to get those QR codes directly through those slides. So we'll share them with all the attendees who registered. So somebody has said, thank you, congratulations on launching the Working Together guide. Are there any further comments that any of the panelists would like to make on where are the biggest opportunities for engagement between health consumer organisations and industry? So are there any areas where we think that there are opportunities that have been underserved before that are better served now, or where are the biggest opportunities? Does anyone have any commentary to that? I loved Elizabeth's commentary around, you know, this is the floor, not the ceiling, and that this is, you know, it's not sitting on a shelf or just producing the Working Together guide that's important, but it's putting it into practice. So if we put this into practice, where are the big opportunities? I think one of the ones that I immediately observe is that unfortunately, our system of funding for health consumer organisations and health consumer advocates does not nearly cover what's needed for people to really make a difference. And I think that there are real opportunities for the industry to help health consumer organisations to have a voice, and those who are struggling with fundraising, with people who are living with illnesses, and also trying to advocate on behalf of their community. Those are real opportunities for us. So anyone else?
I'll jump in, Liz. I think there's a lot of opportunities that some people are picking up on, but we're not seeing across the whole sector. So I think those opportunities for early engagement are just so valuable. So increasingly, we're seeing health consumer organisations prepare when they see new treatments or diagnostics in the pipeline, and they're starting to think about what sort of patient knowledge, what sort of patient experience data would be really critical here. And I think that early engagement can be really valuable. I noticed that those people who are building the relationships, not just over a single item or a single point in time, but are coming back and really getting to know each other in communities, are actually starting to really get down. Like, I think with patient knowledge at the moment, we're right at the tip of the iceberg. We're kind of acknowledging there's knowledge there, but we almost just don't know how much knowledge there is to learn from. So I'm really noticing that those organizations that are working together to build relationships are getting to know each other, and they're giving their relationships time for the trust and the knowledge transfer to grow.
Thanks, Anne. Actually, I just want to shout out Anne. Anne's in Germany. It's 5:40 a.m. She was up at 4:45 to join our call today. So, Anne, thank you, and thanks for a very insightful comment. And I think your tip of the iceberg comment is so important. There is so much knowledge from communities of people with lived experience that we need to unlock. And not just for the benefit of the industry, but for the benefit of those people who need to have access to new treatments or new ways of being heard in their community. So I agree with you.
Yeah, I'll just add as well. I think Anne said everything that I wanted to say, but much more eloquently and more to the point in relation to that early dialogue, and also building those partnerships that go beyond just the sponsorship, something, it's more of a shared purpose rather than just that transactional side of things. But just one more thing I would like to add to that opportunities is being mindful of creating pathways of engagement, particularly for smaller organisations. So that might mean a bit of a lighter touch, remove some of the complexities or fear around compliance to be able to engage with smaller organisations. I think that's an opportunity that industry should be aware of.
Fantastic. Now, I've got a couple of questions coming through, and I think we've still got around 15 or so minutes. Rosemary Ainley, what has been the reaction from the pharmaceutical industry about sharing information with consumers that have sat in grey areas before? For example, some were reluctant to share too much information with consumer organisations prior to PBAC submissions. So I guess, Lucy, do you have a view on that one? I can take a little bit on that. I think that pharmaceutical companies want to share information, and they do rely on the code to give them that framework of how they can, and where does the barrier lie between what is considered sharing information for education and awareness and sharing information for promotion. So Lucy, did you have any comments on that?
Sure, and it's a really good question. I think grey area can be a good way to describe it, because when the main thing that pharmaceutical companies are trying to avoid here is promotion of prescription medicines. And that's to anyone who isn't a non-healthcare professional. And that's, how the legislation is laid out. And from there, how the code then also views, what pharmaceutical companies can say. Look, there have been some changes to the code in Edition 20, which came through in March this year, and kind of recognizing that pharmaceutical companies, we can give them more confidence in talking to patients and consumers about prescription medicines, where there may have been some, I guess, concerns in the past about it potentially being promotional. So there's a new section in the code which talks to that it is acceptable and appropriate and needed to proactively share information about prescription medicines to patient organisations, but it's with the caveat that that's non-promotional, that it's relevant to the information needs of that patient organisation. So it's still within the bounds of the legislation, which it is saying that, promotion can't occur with the patient community. So the code is, it provides that principle. So it's the broader framework where companies work within. So there might be, variations in how that looks, because it is principle based. But the main sentiment is there, which is that companies can talk to patient organisations about prescription medicines.
I think just to build on that, Lucy, and thank you very much, the code of conduct underpins the legislation around promotion of prescription medicines. It is, companies are also, particularly in Australia, part of a global company, and there may be global company frameworks that they have to adhere to that go beyond where our legislation goes. So sometimes we do see companies unwilling to talk to patient organisations about information, particularly information related to PBAC submissions, for example, because of their global decisions around transparency and what they're allowed to share, and less about Medicines Australia's Code of Conduct and the Therapeutic Goods Administration's Therapeutic Goods Act. However, the work of the HCA review is also looking at how do we involve patients earlier in the decision making for PBAC decisions, and some of that is around how do we give information on the PICO, which is the population, intervention, comparator and outcome, prior to or early on in that PBAC submission process. So there is work underway to try and build a framework where sharing information with health consumer organizations and health consumers actually adds to their ability to contribute to the decision making, particularly in PBAC. And companies will be encouraged to participate in that when the HTA review implementation gets underway. There's thanks to Anne Wilson, CEO of Emerge Australia, working with those living with CE and CFS and long COVID, excited that despite the disease cohort being people living with energy limiting diseases and having limited treatment options, they have been able to build new relationships with pharmaceutical companies. That's very exciting. Thank you for letting us know about that. And I think the Working Together Guide is a really important framework to support organizations who do want to build relationships with companies. Manaka, often in trials, patient-reported outcomes are exploratory endpoints or somewhat lower in the level of evidence. How can we elevate this such it's recognized not only at the regulatory and PBS application stage, but also recognized and appreciated by the research community? Oh, I think Anne might have a comment on this, but patient-reported outcome measures using consumer evidence in decision-making. Elizabeth, you may also have some comments on that as well. I think it's a critical step forward, and we need to put some, weight onto the evidence provided by consumer organisations or consumers and people living with lived experience. But Anne and Elizabeth, Anne first.
Yeah, look, it's a great question because it's absolutely critical, isn't it? And we get that a trial to be robust will need a primary driver, and sometimes that's one particular endpoint. But one of the things that the HTA review recommended was actually about making sure that evidence around these other endpoints is not only shaped by patient-reported outcomes, so choosing endpoints that are really important to patient communities, but that it's clearly documented and brought forward in the application. So that's just one of the challenges at the moment in itself, that it's sitting there within the evidence. And then you also see in the co-design work the recommendation that then this information is seen as just as important as other information being considered to establish the benefit. So that makes me want to say also that there's a webinar just after this one on the implementation advisory groups recommendations. And so I really encourage everyone to keep their eyes on that. And I know in Patient Voice Initiative, we'll be trying to share that information too, because these recommendations sit there and they're critical. And the final point I'd make is that there is work going on in Australia and overseas to better involve patient communities in trial design. So making sure that trials are actually set up to capture what matters most and also to be more inclusive. And I really encourage people and I encourage companies to look at that work and look at some of the benefits it's bringing those who are setting up trial design, not just that they're getting to know their patient communities really well, but they're getting information that's incredibly valuable once it comes to health technology assessment. So I'll hand over to Liz. Elizabeth, sorry.
We're taking over the world. There's too many of us. I was in a meeting the other day with 5 Elizabeths. It's fantastic.
Oh my gosh.
So yeah, we might start our own club. What do you think?
I think we should.
Yes. So thanks, Anne. Prims and proms are really important. And as I said, at the end of the day, all we do is about better health outcomes. How do we know we've got better health outcomes? Well, we ask the people who are experiencing that. So we talk about patient-reported outcomes and experiences. Just noting, like, we use the word health consumer because it's not just the patient. If you're the parent, you probably want to have a say in what the treatments are available on, what the impact is on you and your family. If you're the carer, that will be true too. So not only the patient, there's an important human in these decisions. If you've never seen a kind of a big trial that uses Prims and Proms, a good starting point might be the OECD has been running over the last few years a global piece of work looking at Prims and Proms for primary care. It was launched earlier this year. And if you look up OECD, does health care deliver? you'll see that Australia has a report card, and we could talk about that another day. But it does show you what you can do with prems and proms that can give you deep learnings you wouldn't get any other way, and ask you to then consider, well, what you're doing and how you might change that to improve those prems and proms over time. And the OECD's plan, of course, is to run this every few years and hopefully encourage, in this case, not companies, but countries to learn from each other and improve the quality of the care they provide.
Yeah, Elizabeth, it's such an important evolution. And I think we're also seeing that there will be opportunities with digital enablement, using digital technologies to actually use that data more widely and analyze it more thoroughly. And I think that we're a little bit slow in Australia in adopting new technologies or moving policy quickly. So I'm definitely going to look back at that OECD work and see what we can learn from that. I think from a company perspective, somebody has told me recently that actually not every company, when they design their clinical trial, does have quality of life endpoints. They may not have quality of life endpoints at all, or they are very secondary to their study. And really, that's the heart of what is the patient outcome. It's not just the status of the disease or the condition, but it's also how it impacts on their quality of life, and as you say, the quality of life of their carers or families and people who they work and live with. So thank you for that. There's a couple of comments which may be over to you, Lucy, and you may not be able to answer them here. There's one around advertising medicines to consumers, obviously recognised as not appropriate, but shouldn't companies be able to sponsor consumers to attend conferences and symposiums? And I think that healthcare professionals often receive grant support. Shouldn't consumers have access to the same thing? And then there's another question, both to you, Lucy, so I'll do them both at the same time. In terms of ability of medicines to be discussed, is this only post-TGA registration? There are examples where TGA registration may not have occurred before PBAC listing. Does that limit that discussion?
Yeah, but both really good questions. And I think these are two questions that came up in our consultation with health consumer organisations. So I'll briefly touch on them, but I would really encourage you to look at the fact sheets as well, because there are two that really go into that quite well. So the first one in terms of events, so my understanding is that our members do sponsor some patient representatives and patient organisations to attend, various international conferences in terms of accommodation and registration fees. I hear, the concerns have been raised about the attendance of consumers in certain congresses where there is promotional material being provided, and there's questions about why they aren't able to, attend sessions like that. We completely understand and hear that, as experts in your own conditions, that being able to be privy to that information is obviously completely reasonable and appropriate. It's just where the information becomes promotional, and it can be very context dependent. So what we're now looking at is more so about, where the Therapeutic Goods Act is very clear in terms of non-promotion to consumers. What are some other ways in which we can get patients that information that they are asking for? So I know we've been talking with event organisers about some non-promotional sessions that are, geared towards patient experts and representatives, where they are still able to receive that information, but not in the traditional sense where it's promoting to a healthcare professional, because that can look very different. And it is ultimately about, abiding by the law and ensuring that when our companies are sponsoring those events, that they are following the law. So it is a bit of a tricky area, and we do recognise that, but we are looking at ways that information can still be given to patients, when it's needed. The other question, You'll have to remind me, Liz, it was
Yes,
about
in terms of enabling people
prior.
to talk about medicines,
Yes.
do they have to be registered by the TGA before you can?
Yes, yeah, great question. So that was another change that came about with Code Edition 20. So we referred to that as scientific exchange. So any talk or exchange about unapproved medicines or off-label. So there is more risk and I guess more requirements that comes with those particular conversations, because not even doctors can be promoted to about off-label indications. So it's a really like strictly regulated area, and for good reason, because those medications, they haven't been through all of the checks and balances for TGA registration. But there is, you know, there is still merit in hearing about the clinical trials and, you know, what is coming through the pipeline. And we recognize that, and there was a change to Code Edition 20 in scientific exchange, which it is supporting that scientific exchange doesn't just have to occur with doctors. It can occur with all different types of stakeholders who are, you know, who have a need for that information, and that includes patient organizations. So there are ways to communicate that information in a non-promotional manner. And, you know, a lot of the work that Sophie and I do is about educating our members about how that can be done in an ethical way and making that consistent across the board. So it can absolutely be done. And it's an area that we, you know, we always receive questions about and are always welcoming feedback on.
Thanks, Lucy. And I think the important thing we have to remember is there is a line and a difference between promotion and education, awareness, and scientific exchange. I also, we've had questions about what constitutes a healthcare professional, and when it comes to actually giving promotional material. So there's a lot of information in the fact sheets, and anything that's missing or questions that need more detail, we'll receive feedback on, and we can improve our resources as we go. So that's an important thing. I'm looking at the time. There's just one more comment. Floor and ceiling emerging fast. It does mention we know pharma are not close to partnering and co-designing beyond transactional efficiencies. Well, let's hope we're starting that journey and going beyond transactional relationships. Patients don't just have knowledge, history, lived experience, clinical trials, and HTA skills, but can now access powerful tools to interrogate claims of efficacy and counter old patronizing rationales. Pharma need expert patient partners and independent partners, or they will not generate credible evidence due to the contradictions in each condition and new biology understandings. Patients can use medical philosophy, move validated real-world evidence, and the self as control, etc., to top position where transformational change should be, particularly for heterogeneous populations. I think that's a fantastic note to end on. We've still got a journey to go, and pharmaceutical companies need patient expert partners to assist us to understand and get better health outcomes. I think on that note, we've clicked over to 3 o'clock. Thank you so much to an amazing panel of speakers and experts, and we will continue this journey, and we now launch the new Working Together Guide. Thanks, Elizabeth. Thank you, Melanie. Thanks, Anne, and thanks, Lucy.